I'm a pharmacist by background, and I've worked about 14 years in primary care, racking my brain, trying to find a way of trying to sort of improve adherence and reduce medicines waste. And each year it's been the same, medicines returned. And so I started getting curious about, what is it that we need to do? How do we reframe this in a different way? I mean, is the solution out there or is it in here? And actually, it's in here. And it's that sort of skills that we talked about mindset as well, about unlocking the potential within yourself as a health professional before you can actually do it with patients. So to me, health coaching was like a key to a locked door of doing that for health professionals, to activate them and see the potential in patients. Medicines optimization is something in our profession we talk a lot about, and what it means is using medicines to get the best health outcomes. But this is what we get returned, £150 million worth of waste that's returned in these yellow bags. Now these yellow bags represent to me health loss, sort of admissions into hospital, loss of disease progression, a whole set of things that we really don't want to continue. So in a way, it's like sort of how do we turn this around? I mean, some of the other statistics for people who do like statistics is that, NICE say that 30-50% of patients don't take their medicines. And that's quite stark because medicines is one of the biggest therapeutic intervention that we have. And how do we shift that? So this, to me, is like two types of paradigms that we have of how do we behave now to how do we move in the future. So from a population perspective, improvement in medicines taking would have a huge clinical outcome in clinical outcomes. But adherence is really very complex, and the key thing that I think health coaching fits in is the intentional non-adherence, because intentional non-adherence is about linked to beliefs, about the inner representation of disease within the individual, and how do we unlock that? It's about emotions, it's about how we feel about things, and sort of the wider complex, wider determinants that we live in. So, for the finance people out there that might be interested, Nina, I was talking to Nina, who's a colleague of mine, she was saying that there's a report that she read, about £500 million worth can be added value by 5 therapeutic areas: asthma, hypertension, schizophrenia, and also diabetes as well. So it's quite significant. So there is a lot of weight to actually start moving and behaving in a different way. So from my perspective, I'm very excited because I think there's real potential and synergies with pharmacists and consultation skills, because that's what we've been talking about here, is about consultation skills. How do we do things different? And the role of medicines adherence and where we can do it. Now, I think that health coaching can fit through the whole continuum of care for medicines link in. So in community pharmacy, I feel that it's really very exciting because we talked about time. Pharmacists do have time. We have infrastructure, we have architecture in NHS, such as targeted medicines reviews, which is like a quality 20 minutes time. But how about having that consultation more flexibly, not rather than listing a list of questions, but doing it more flexibly, sort of asking sort of more open questions. There's potential for behavioural change in community pharmacy that health coaching can be intimately used very effectively. In secondary care, Nina was telling me a story, and I'll be very quick about it because I think it sort of also shows that even though we're patient-centred, and she is a very good health coach, she described a story to me where she was asked to see a patient who was an alcoholic person with alcohol problems, atrial fibrillation, and was obese. And she was thinking in her head, oh God, this is going to be a hard one. I'm not going to manage this. This is going to be really hard. But straight away, she met this gentleman, and he was able to tell her, the comparative risk between warfarin and aspirin, and she was like dumbstruck. So in a way, that the health coaching challenges those assumptions and actually allows you to see the potential in that person. That person was then enabled to take warfarin and be supported and actually manage all his other problems. So there is a whole set of areas that we can get involved in. So to me, the key message I wanted to give, to talk about really, was 3 things. 1, changing the mindset. That's really fundamental as health professionals and pharmacists in particular. And the other thing is that enhances the consultation skill, and pharmacists that potentially has the benefits to do that. And the third thing is it enables empowering patients to take their medicines. So I'm going to wrap it up now. Okay, thank you.